Dr. Aronovitz, nice to meet you.
Nice to meet you.
Thanks for coming in today. Tell me what's bothering you about your hair loss.
Well, I have this little patch, this little bald patch back here that seems to be growing.
Okay.
And I would like to just have you take a look at that and see if there's anything I can do to treat it.
So the frontal part's not bothering you as much as the crown part of your head.
That's correct.
Okay.
Yes.
Up to date, have you done anything at all to try to help with this? Any of the medications available or anything like that at this point?
Yes, I've started using Rogaine and I've been putting that on the back of my hair.
Great. That's a good start. How long have you been doing that for?
I am on 2.5 months right now.
Awesome. Very good. All right. No problems with it? No itching, flaking, redness, nothing like that to your scalp?
None at all.
Beautiful. And the finasteride or Propecia, you've not attempted to try anything with that yet?
No, I have not.
Okay, very good. So my goal is to kind of look through your head first, see what things look like, and I'll do that in a moment, and then we'll go through the whole details of the surgery, tell you if you're a good candidate and so forth. The start of the Rogaine's been really good, but you have these very short, finer hairs throughout this area that are called vellus hairs, and these hairs are showing me that they're kind of going out of cycle and you're about to lose them. So the Rogaine will capture those and bring them back. So there's a good chance a lot of this will fill in. But there's also spacing where you're seeing some baldness down to the skin level, and most likely those follicles are gone and you'd have to replace it. But back here, where the hair is very thick and where we get the hair from the donor area, you have plenty of good hair back here to take care of that for you if you want. I mean, looking at your scalp, you absolutely have what looks to be like a genetic hair loss. So genetic hair loss is something that's passed on from someone in your family, either from the mother's side or the father's side. You get the gene, and when you have the gene, it expresses itself differently in everybody. Some people have this hair loss that's complete, where all you see is a little strip around the back of the head. Other people have a little recession or a little crown loss, and that seems to be where you're at right now. At your age, there's still a future ahead of you. I equate it to being on a train track. The train track's moving. How far and where it goes and where it ends up, I have no idea. There's no way to suggest where you're going to be at the end of the day. The fact that you've already started a medication is the greatest thing you can do, because that does help at least to halt most people's hair loss and sometimes regrow some hair. So looking through the scalp right now in the back, there are areas where the hair is actually gone down to the skin level. That means that the follicle most likely is gone and dead. So even medication won't bring those back. So in that case, it becomes something you need to transplant in order to get the hair to grow there. So if you're walking down the street, you see a guy who's bald, unless they shave their head, they all have that little strip around that back part of their head. Well, for some reason that genetically is different. The predisposition to lose it's not there, so we use that hair to place in another area. It's fancy farming of real estate, basically. We're taking good hair, putting it anywhere else, and it will grow just like it did in the back of your head. Okay? So the process is we need to get what's underneath the skin. We need the follicle. That's what grows the hair. The follicle, think of it like an organ, think of it like a tulip bulb. The tulip bulb's under the ground and the plant is the hair coming through the surface. So we then need to take that whole bulb and replant it in the areas we're using it. So we cut the bulbs out, we make little tiny openings everywhere we need to place hair, and we plant them. They come along with a little hair in them, but the hair does not last. The transplantation usually makes those fall out. Was never after the hair though. I'm only after that little bulb or follicle. It takes then about 4 to 6 months in that follicle to get the right nutrients from blood supply, oxygen, things like that, to grow the new hair. But once it starts growing, it is a permanent hair. It will stay there for the rest of your life, just like it would have if it was from the back of the head.
Is there a way I can finance this and not have to pay all the money at once?
So we offer financing through a company called Care Credit. So you can finance the procedure so you won't have to make the upfront payment that you usually do.
Can you tell me what sets your office apart from everybody else?
So I think that's a very important question these days. The people who are involved with hair transplants can come from any background. There's no real guideline that you have to be a certain kind of physician. You do have to have a license, obviously, to practice, but you don't have to be a certain physician. My background is that I'm a board-certified facial plastic surgeon. So from that, I've gleaned the ability to do good artistry in my work, and I've been doing this now for over 16 years. So I think that is an advantage for me to actually perform the transplant. The second thing is when we're doing the transplant, I have a team that works with me. So when I harvest the grafts, I have an assistant. I place that grafted material onto a back area where my technicians then divide it up into the follicles that we'll use for placement. Then we all place them in. So I'm involved with every aspect of the procedure, and I'm in the room with you the entire time. Other places may not have that available.
So I do use a little bit of hair product in my hair. Am I going to still be able to use the hair product?
Yeah, so once this hair grows in, it is your hair. It's your real hair from the back of your head. It's not anybody else's, so you can do anything you want with it. You can wash it regularly, you can cut it, you can dye it. It's not going to change the way you treat your hair. So products are absolutely fine on the new hair.
So you mentioned earlier about using medication. Can you tell me more about that?
Sure. So the FDA has 2 approved actual medications you can use for hair loss. One of them is Rogaine. The generic name is minoxidil. It's a topical compound that you actually rub into the scalp. It takes about 4 to 6 months for that to also start working on your hair, but it can regrow hair that is finer and starting to dwindle out. The second product is called finasteride. It used to be called Propecia. That medication is an oral medication you take once a day that does the same thing. So I encourage people to come into this arena fighting with everything they've got, especially if they're going to spend the time and money to put a transplant on their head. So the medications are very important. One or the other works fine.
So am I awake for the surgery or do you put me under? And what happens after the surgery?
So for the portion of the procedure where we're doing the actual harvesting, the grafting, you'll have some Valium. You'll be sedated, but you won't be under a general anesthetic. So you will be alert, you'll be awake, you'll understand your surroundings. After the procedure is all over, the home care is pretty simple. We go through that at the end of the day. But the discomfort comes only in the back part of the head where we've harvested from. People describe it as an ache or a tightness because we have to suture some stuff back there. But using ice, and I give you some pain medicine to go home with, so people are pretty comfortable for the first 24 hours.
So I work in an office and I want to keep this private. Are people going to know I had this hair transplant done?
So that's a good question. Generally speaking, you will be able to see where the transplanted hair is. So again, we transfer a small, short hair with the follicle. That hair stays in probably 7 to 10 days after the procedure. So everywhere we've made an opening, you'll see those. But you have the ability to wear a hat if you're able to at work. If your hair is long enough, you can actually cover over the area since we're going to be working mostly in the back of your head. The hair that comes in will look exactly like your other hair. One of the things we take a painstaking attempts to do is to angle it correctly with the hair that's around the area. So it will grow in the same pattern as your other hair, but it'll grow at a rate of about a ½ an inch every month. So at 4 to 6 months when you start to see it come in, it'll be short, but then it'll start to catch up to the other hair on your head.
So I've seen people with hair that looks fake that may have had a procedure done. Is that what my hair is going to look like?
So I think what you're referring to is an older technique that we used to use where we used to plug out the hair in the back of the head and we'd place maybe 5 to 10 follicles together in one spot. It kind of looked like doll hair, that's what most people say. But nowadays technology's advanced so much, we're able to divide the hair down to one single follicle. Occasionally only one hair comes out of that follicle. So we then place them strategically to look like a natural hairline and natural hair.
So once I get the hair transplant done, do I need to get it done again down the road, or is it permanent?
So again, the hair that we transplant will be permanently growing. The future of your hair loss is what we don't know. No one has a crystal ball to help us tell where someone's going to end up. So I always encourage people to consider the medications because it does help to stabilize what hair you have left. The only part that doesn't do as well as typically is the frontal part of the head. It's just very weak. So even with medication, you sometimes lose that. So it really depends on you and how you do afterwards. I do see people back occasionally for fill-in type procedures just to kind of thicken things up. But once you get to a certain spot with the hair in the area, it'll be permanent and filled in forever.